Hello, viewers and listeners. Yeah, yet welcome to another edition of the program, Midday Vibe. Coming your way on Calipet TV, transmitted on channel 141 on Star Times, and Calipet Radio, transmitted on 91.9 MHz. I am Muktade Gwanga, your host for the day. In today's edition of the program, we'll be discussing about cervical cancer, which is part of the issues that are bedeviling women in our communities. In the show today, we will be looking at the causes, preventive measures, and even detection processes, as well as the treatment available in Nigeria. And to discuss the show, I am here with oncology nurse Asma Uwurno in the studio. Nurse, you are welcome to the show.
Thank you very much. Happy to be here.
All right, thank you. So hope viewers and listeners will follow us to hear what we are going to discuss. All right, now, Nurse Asma, for a start, viewers and listeners have been hearing about this cervical cancer. I would like to know what exactly is this cervical cancer.
As earlier introduced, I am Asma Ibrahim Wurno, working with the Usman Danfodio University Teaching Hospital at the Oncology and Radiotherapy Unit. Cervical cancer is a cancer that develops in the cells of the cervix, the narrowing portion of the cervix that connect the uterus to the vagina. It usually begins when the cells there begins to grow uncontrollably over the time. The main cause of this
after we would like to know, following knowing this, what cervical cancer is now, what usually causes this particular issue?
Actually, the main cause of this cervical cancer, picked by the WHO, is human papilloma virus.
Okay.
That has high risk type, that is type 16. And there are some risk factors that also predispose a woman.
Okay, may we know the risk factors, like some of them?
Of course. Some of the risk factors, we have the modifiable and non-modifiable.
Okay.
The non-modifiable is the one that you must have a cervix before you have this cancer.
Okay.
And you know, men doesn't have cervix.
Cervix, yes.
Exactly. But the modifiable risk factors are, one, you need to make sure that you don't smoke.
Okay.
Because smoking is one of the risk factors. And make sure that your lifestyle changes. You must follow healthy lifestyle.
Okay.
To prevent yourself from getting this infection.
Okay.
Another one is you must be vaccinated. Because most of the vaccinated ladies that were vaccinated at early stage of years, like when they were young, they hardly get this cancer.
Okay. All right. So now, Nurse Asma'u, having had this now, how does a lady detect that she is having this cervical cancer? You know, when you say that disease, then there are certainly some symptoms that when one's seen, we realize that he is having this particular issue. So now, how does a lady, I'm a lady, how did I realize that I'm having this issue of cervical cancer?
Yes. Honestly, before a lady, we don't even want a lady to detect that she has these symptoms.
Okay.
What we want her is to go for screening.
Okay.
Immediately you are a woman and you reach the age of 20, or you need to go for screening.
That's as preventive measure.
Preventive measure.
Okay.
But the actual screening to know that you have this, to check and know whether you have this, is when you notice there is unusual bleeding.
Okay.
Between period, or you have reached menopause and you are having bleeding, or you bleeding continues for a longer period of time. So it's another thing that you need to find out. And if there is pelvic pain,
okay,
pelvic pain or pelvic pressure,
okay,
there is need for you to go and check. And if there is pain during sexual intercourse or after sexual intercourse, or bleeding after sexual intercourse, there is need for that woman to go for check-off. And if there is full vaginal discharge, discharge that is smelly or anything that is not normal, she need to go and check.
All right, before we get there, you made mention of an unusual bleeding between the cycle, that's the menstrual cycle. So what does that mean? Like, is it after your period, the bleeding continues, or no, it takes time to just show up?
Yes, bleeding, for example, now, we all know the normal menstrual period, you knew your menstrual period, and then after that, another one came. When you are done, another one came.
Like constantly?
Exactly. There is need for you to go for check-up. It might not be cervical cancer. It might be another issue.
Different issue.
Yes, of course.
Okay, so as you talk about this screening of the issue, now, how does someone go for this screening? As in, where is a female supposed to go for this screening and when?
That's a good question. Honestly, the main screening for cervical cancer is HPV test and pap smear test.
Okay.
HPV test is done to detect the infection.
Okay.
And I have told you that human papilloma virus is
root cause
of this with the type, because there are many types of human papilloma virus. But the one that causes this cervical cancer is type 16.
Okay. Okay.
It's a high risk. So HPV test checks for that. While the pap smear test for precancerous cells on the cervix. You will just go and then they will take a sample, and then it will be, the cytologist will check it, and then if there are precancerous cells there, then treatment will commence, and before it develops to cancer.
Okay. So now, whenever we talk about hospitals, most of our locals think of spending money. So this testing, this screening, how affordable is it to masses?
Honestly, it's affordable because it's a life-saving test.
Okay.
For you, it's good to spend your money to get before disease. Because if you look at the cost of the treatment, it is overwhelming. Honestly.
Yeah, sure.
So the cost is for HPV test. It is cost affordable, but even the pap smear test less than 5,000.
Okay.
I think it's less than 5,000, and you can come to the hospital, and then they will. Even the HPV test is available in the hospital, and I don't think it will be a thing that some people cannot afford it. But there are some good philanthropies that assist.
Okay.
For those that are less privileged, even the one we did outreach, we did free pap smear test for women. Honestly, we did that, and many came out, and thank God, some of them that were found with precancerous cells, and they were treated. Yes, it is very, very important to go for your checkup to see if there is any problem. It can be tackled. I could remember there was a woman that was very inquisitive. I always admire that woman.
Okay.
And she's still alive up to now. She was very inquisitive. She found out that after intercourse with her husband, she used to have pimple sexual intercourse, which she came, and then it was ruled out, and definitely surgery was done. TAH, that is total abdominal hysterectomy, and she is still living her life without any problem.
All right, ladies and viewers, this is your show, Midday Vibe, coming your way on Calipet TV, transmitted on channel 141 on Star Times, and on YouTube at Calipet Radio and Television, as well as on Facebook at Calipet TV, and live on Calipet FM, transmitted on 91.9 megahertz, and on our website, www.calipetpodcast.com, and on TuneIn at Calipet FM. And in the show today, we are discussing about cervical cancer, treatment, and the preventive measures. All right, and we are with oncologist Asma'u, I'll say nurse Asma'u, who works with the oncology department at Osman Danfodio University Teaching Hospital. Okay, now nurse, we have heard about all this cervical cancer, how it becomes and what one needs to be done. So you made mention of human papilloma virus, which is well popularly known in our communities. And you made mention something like vaccination about it. So how did you think, or let me say, is that effective in treating this cervical cancer?
Yes, definitely. The vaccine, I believe, is available now.
Okay.
It is very and highly effective.
Okay.
If you look at the developed countries, it's hard you see women with cervical cancer. But in our middle and low income countries, which Nigeria is included, including Sokoto, where I live, we were not immunized then with the vaccine. But now that it's available, I think every family should take their words for that screening. And then this vaccine, I told you that is highly effective.
Okay. So now, how do someone access this vaccine, and is it free?
It's accessible and it's free. And I think the state government has already, commenced the campaign.
Okay.
Since last year, they have started, even school-based, they have started giving that vaccine. So I don't know, because there are so many misconceptions about the
vaccination normally.
But they have.
Okay, so now, let me just ask this question, though I don't know your knowledge about, but what are the spots or places that one can go and get these vaccinations? Like, is it in primary healthcare or tertiary healthcare organizations or anywhere? Like, where do people go and get the vaccination?
Yes, of course. The vaccines are available in the primary healthcare.
Okay.
I'm not in, but I don't know the Ministry of Health. They are the one to answer this question. But I know that, yes, then it's available. I don't know of now.
Okay.
And even in the tertiary hospital, the vaccines are available.
Okay, so as a nurse that works with all these cases of cervical cancer, what did you see as the major challenge in treating this particular issue that we are discussing?
Honestly, cervical cancer had made so many families vulnerable because of loss of loved ones. A family with 12, 13 or less than that, a mother died of cervical cancer. You see, that family is totally, it's going to be devastated.
Yeah, that's true.
So, honestly, cervical cancer, in my unit, we see them because the cost is overwhelming.
Yeah.
You see, they have to go for surgery, which is very costly.
Okay.
And then they have to go for radiation therapy. The radiation therapy is a procedure that is done to shrink the tumor. In shrinking that tumor, there is going to be quality of life.
Okay.
And then they have to go for chemotherapy.
Okay.
The chemotherapy are very expensive. Some families cannot afford. They have to take about 6 courses, 6 cycles of chemotherapy. Yes, true. And each cycle can take up more than 50 to 60,000.
Wow.
I'm talking to about the drugs that are not cheaper drugs, but the expensive one is, and they have to take it for 6 cycles, and that is not the end.
No.
They have to, the family role is there. You see families coming down, caring for the loved ones, and the expenses is too much. So honestly,
Seriously, this issue is a very devastating issue, and that's what makes me want to ask now. Uh, like when is someone supposed to go for this screening? Like, is there a stipulated time after which an individual should go and screen, or is it only when someone experience one of the symptoms that he go for screening?
Oh, before you experience the symptoms, it's very good to go for screening. First, get vaccinated.
Okay.
After the vaccination, there is need for screening again. Just because you are vaccinated, you have to go for screening.
Okay.
Screening is done to detect a problem.
All right.
That is the essence of going for screening. So if you go for screening, if there is any precancerous cells, it will be, recognized and then be treated. The screening commences at the age of 20, or even once a woman has sexual intercourse or any skin-to-skin contact.
Okay.
Because HPV virus can be transmitted not only through sexual intercourse, through skin-to-skin contact.
Okay.
It can be transmitted. So at the end, you need to go for screening. And then 1 to 2 years.
Okay.
For 20 to 30, from 35 years to 45 years, or at least 3 years. You need to go for pap smear test and HPV test.
Okay, if I get it right, you mean from anyone between 20 to 30 years, is they are supposed to check between 1 to 2 years.
Yes.
Either once in a year or 2 times in a year. Okay.
Then, if you are more than 30, 45, 60, then you need to go. If you do it for this year, then after 3 years you
go and do it again. Yes. Okay, so now we all know there used to be this services after the treatment, and I will ask 2 questions maybe at a time. Or let me just take it one by one. Now, I have checked and I have been tested positive of this particular disease, and I was treated. Do I need to do anything after the treatment?
Of course, you need to go for follow-up.
Okay.
Yeah, follow-up is very vital.
Okay.
Because if you are doing follow-up, it will help the physician to detect early if there is any recurrence.
Okay.
Because the disease will occur. And if there are some side effects of treatment, like this radiation therapy, there are some side effects. For example, now there may be cervical stenosis or vaginal stenosis.
Okay.
So if care is not taken, then the vagina will be closed. Okay. So definitely there is going to be problem. So that is why it is good to come for follow-up visit for early detection of recurrence, treatment of side effects later, and then to improve quality of life of that individual.
Okay, and usually whenever we talk about disease, you realize depending on the culture of the environment, there used to be misconceptions. So I don't know, sometimes we need to express something in a manner or a way people understand it. Like, number one, does this cancer have any name that we do call it in our Hausa tradition and how we term it? For example, when someone is having something like mental health issue, they will say isko ikai, So maybe by using this word, someone will realize the exact particular disease we are regarding to. So number one, does this have any similar synonym that we use in our local community?
So what I knew is that once we tell women that there is ciwon daji na bakin mahaifa,
okay,
they will understand.
Okay.
If they say ciwon daji na mama, okay, they will understand.
Okay.
I think that is the only one I know, but I don't know if you have any.
Okay, so now, no. So now, what are you are working with these people, and they used to come with misconceptions. So can we know part of the misconceptions by the communities regarding this issue?
Some will say, they told me that if I come and then I will bring, if they start checking me, that problem will come, definitely. which is not true.
Okay.
Because we have been checking ourselves. We have been checking every 3 years. We have been doing it ourselves to check. Because once you are working there, you know it now. You have to go and look and check for yourself. Of course. So honestly, there is no of that. And some women will say there are some concussion remedies that if you take them, and nothing will not. But I think there's some nothing cervical cancer or breast cancer will not affect you, which is not true. And the prevention is you get vaccinated, get screened, and then do the next.
Okay, we forgot a serious question. What are the most common, leading causes? Like, what are the most common ways of getting infected with this? And is it transmittable?
Yes, HPV virus is transmittable. Not only, I told you that the HPV virus is an oncovirus.
Okay.
Oncovirus are viruses that are contacted through sexual intercourse.
Okay.
Human papilloma virus, type 16 and 18, is the one that mostly causes
the
cervical and nasoropharyngeal.
Okay.
We have Epstein-Barr virus, which causes lymphoma and nasopharyngeal cancer.
Okay.
We have hepatitis B and C virus, which causes liver cancer.
Okay.
And another last one is the Helicobacter virus, which causes stomach cancer.
Okay.
So these viruses are contacted through skin to skin contact, not only sexual intercourse.
Okay.
Yes. So that is the.
Okay, so now you made mention earlier that male doesn't have this cervix.
Exactly.
So are they capable of transmitting it, maybe lifting it from someone and transferring it to another person?
Of course.
Okay.
Because the HPV virus 16 and 18 is one that causes cervical cancer.
Okay.
It doesn't cause cervical cancer to men.
Okay.
That is what I mean by that.
All right. Thank you very much. Viewers and listeners, still a show, Midday Vibe, coming your way on Calipet TV, transmitting on channel 141 on Star Times, and Calipet Radio, transmitting on 19.9 megahertz. And with this, we are going to take a short break. And when we resume, the program continues. Remember that immediately we resume, we will open up our lines for you to chip in and ask questions where necessary or seek more clarification on the matter we are discussing. Stay tuned and enjoy your day. Let's go for a break. The program continues shortly. All right, welcome back, viewers and listeners. This is still your show, Midday Vibe. Come your way on Calipet TV, transmitting on channel 141 on Star Times, and Calipet Radio, transmitting on 19.9 megahertz. And remember that you can join us and watch this on YouTube at Calipet TV and Radio, and on our Facebook page at Calipet TV. And you can also listen to us on www.calipetbroadcast.com. In the show, we are discussing about cervical cancer, which is the major problem affecting females mostly, without even knowing that it is in them. Whereby before the break, we discussed about how to understand that and how to even prevent it first, because that's the major thing. And with me in the studio, I'm with nurse Asma'u Shagari. Asma'u Ibrahim Wurno, pardon me for that. Asma'u Ibrahim Wurno, who is hosting us today. All right, now, before we proceed, our lines will be open for you to chip in. And the number to call is 09060002022. I'll repeat the number, 09060002022. So now, Nurse, before we start receiving calls, whenever we talk about health issues, there used to be, as I said, misconceptions and perceptions about the particular issue we are regarding. So now, I know you have been battling with people to come and screen themselves, get screened before even the occurrence of the issue, let them know their status and what have you. So what are the most common challenges you faced when you come to about creating awareness in populace about this particular issue of cervical cancer, pardon?
Yes, thank you for this question. Honestly, we encounter so many problems, more especially to those that believe that once you come to the hospital, you are just creating problem to yourself.
Okay,
which is not true. When you come, you tell us what you want us to do for you. We do it for you, even though it depends on where we go.
Okay,
and there are some facilities that they don't have the equipment to do the procedure.
Okay.
Instead of them to refer the patient. For example, now, most of the patient that comes to us came at late stage.
Oh wow.
which is very bad.
Bad, seriously.
So most of them, the